you know, if we say to our doctor and we smile nicely to our provider and say, oh yeah, we're taking it, they just add another pill on because they can't understand why your blood pressure, for example, is out of control. Or, yeah. So let's move to the next. Oh,
I just got one question for Tom. I did, if I'm not mistaken, hear him say that he forgot to take his medicine some days.
Sometimes I forget, sometimes I just blow
But
it
you know
off.
what I do when I forget, like my insulin or one of my medicine, and I've got a certain timeline that I take my medicine in the morning. And if I don't take it that time and I forget, you know what, and I do remember, and if it ain't too late up in the afternoon or in the morning, I go on and take it anyway.
okay, so that's a great point.
Yeah.
But I think Tom's describing just a sort of a apathy, maybe, Tom,
Yeah,
a lack of
that's a
motivation.
good word for it, yeah.
Which gets back to our original sort of scenario, which is this person saying, you know what, I wake up late, or maybe I get distracted, I don't think about it, right? So actually your example was great, Tom, thanks so much for sharing that. That was a great example, very consistent with what we're dealing with right now, okay? So let's get back to the bipolar disorder, but let's think about Tom too, because it might help to solve Tom's problem, okay? So the problem, as you can see on your handout, I forget to take my morning medication for bipolar disorder, okay? That's the problem. Now we're gonna define some possible solutions. The key is here, T-Timmers, you need to think of all the possible ways you wanna solve the problem. Don't shut them down. A lot of times we say, that'll never work, right? So think of all the possibilities and don't judge them as they're coming out of your mind, okay? Just write them down. You can throw them out later, but just write them down, okay? All right. Then you're gonna define the possible solutions. And so, Denise came up with a possible solution. She just looks at the timeline and she says, it's still within an okay time for me to take my medication. What's another, we talked about with Tom, we said, well, I'm gonna talk to my doctor about it, right? Okay, but let's look at the possible solutions that they suggest from the curriculum that you're looking at. I could take all my medication at bedtime, okay? So putting in Tom's example, you just double up on his glucophage at bedtime, or his high blood pressure medication at bedtime, all right? We talked about this, interestingly, we came up with this as we problem solved as a group. I could talk to my doctor about giving me a medication that only needs to be taken once a day, right? Or I could just give up on the medication. Again, let's go back to the bipolar disorder entirely, since I'm still depressed. I'm still depressed, so why not just give up? But actually, it's very similar to what Tom said, right? Tom's like, I don't notice any difference, why bother, right? And I think if we're honest with ourselves around the group, and Loretta's shaking her head, I think we're all agreeing that we've all been there. We've all said, you know what, why bother, all right? So let's look.
I
Okay.
had real quick, I just want to say, you know, and you know, this is diabetic excuse me, medicine we're talking about here.
Actually, not right now, we're just talking about medication in general. Tom's
Okay.
example was diabetic
Okay,
medication.
well, I just thought that maybe if you talk about medication entirely, I was thinking, well, if you was taking diabetic medicine and you still feeling depressed, maybe you could talk to your doctor or psychologist about taking something for depression.
Thank you, that's a great point. That's
Okay.
exactly.
That's all I want
So
to say.
for Tom, if Tom said, not only am I not taking that, but I'm still struggling with depression, that's exactly right.
Yeah.
Here, that's a great point.
Yes.
Okay, so now we've identified the problem, and we were very specific about the problem. Okay, that's the other thing, T-Timmers, you wanna be specific. I forget to take my morning dose of my medication. Then we evaluated, then we gave 3 different ideas, right? Okay, and now we're gonna evaluate our different solutions that they give us, okay? And by doing that, we're gonna do the pros and the cons, okay? All right, first we're gonna start with the solution of number 1. I can take all my medication at bedtime. The pro to that is, well, it's easier to remember. I just do it once a day, okay? The con to that would be, now again, this is back to the bipolar disorder. I'm gonna be too tired in the morning. A lot of mental health medications do make us tired. Absolutely make us tired, right? And now I'm going to probably oversleep. If you go back to the original scenario that we read, this particular patient was already oversleeping and already feeling like it was hard to wake up, okay? Yeah.
And you know, I just symbolically came up with a solution, maybe. You know, if the doctors prescribe you to take it in the morning, it's a reason why he haven't having you take it in the morning because it's probably better work for you and your body and your
Right.
and how it works in your body.
Right.
And sometimes, the con was saying here is too tired in the morning will probably make me oversleep.
Yeah.
Well, that's the time you probably want you to get up and take
Yeah,
it.
yeah.
So that's very vital.
Right, that's a very good point. And again, we all interact with medications very differently. So what might work great for Tom might not work well for me,
Right.
or for Sonia might not work well.
Right.
So we have to know who we are as
Right.
people. Okay, the next one we came up with was, we are so glad to see you.
Oh.
We were so worried about you. Sorry, we're taking a little break here to welcome one of our TTIMers,
Watch the camera.
One of our senior members.
one of our senior members to the team. This is Miss Loretta.
Hi there, everyone.
We knew you were coming, Loretta.
I'm glad you had that certainty about me. I
We
had
did.
it about myself.
We did,
And I apologize for being late.
and that's okay,
It's
Loretta.
okay.
We're gonna tell you exactly where we are. Our peer educator is Miss Sonia right here, but we've been talking to your chair, even though you're not here,
Okay.
okay? You just take your time, take your coat off, your gloves, make yourself comfortable.
Okay.
Have some nuts and some cheese.
That's
That's another aside that you might wanna make sure that you prepare and provide some healthy snacks that are consistent with the healthy plate and what you're trying to describe as far as nutrition goes. So our cheese sticks are high in protein, they have about 7 to 8 grams of protein, almost no carbohydrates. The nuts have a healthy fat, they have very low carbohydrates, but they also have some fiber and some healthy protein.
And it's mozzarella, so it's lower in saturated fat than a cow's milk.
Absolutely. But the serving sizes you've gotta be careful with, because both are calorie dense. So this snack that we have before our T-Timmers right here, is about 200 calories, which is about the max that we wanna do. So what page are we on, Miss Sonia? So we can tell where Loretta, where to be?
Page 3.
Is there, pages there?
Yeah.
So, hey, so Loretta, just to make you aware, this is kind of dull and boring because we're doing the same thing all over again, okay? The difference is that we have Sonia as our peer educator, okay? So she's about to, we're gonna come into the idea approach and you're gonna be the leader on that. You're gonna come up with so think, what do you wanna present, okay?
Oh my, oh yes.
Okay.
I have.
You have an idea? Okay. So now we're evaluating the solutions, okay, Loretta? All right. Okay, so now we're gonna talk to our doctor about giving you medication that only needs to be taken once a day, which is a wonderful idea. The pro to that would be it certainly would be easier to remember. Everybody okay with that one? All right, and it might even work better. What's another reason it might work better? Because you're gonna take it. It's just once a day, all right? The con could be that I don't have a doctor's appointment for 2 months, so I can't mention this to my doctor, right, for 2 more months, right? But here's the answer to that. I could probably get an appointment sooner if I called. What's another way that you might be able to reach your doctor a little bit faster?
I use my chart now.
My
My
chart.
chart.
Yeah,
My
I was gonna
chart.
say my chart.
And so for those of around the table who might not be familiar with my chart, Sonia, what's my chart?
My chart is, it's, different hospitals have it differently. Well, like at the one I go, well, it's where I could log in, see information between me and my doctor, see my appointments, schedule appointments. If I have a question towards my doctor, I could ask them. Some of them answer within 24 hours. Some of them answer 48. Some quick, even
Okay.
quicker than that.
Okay.
Depends your doctor. It's where if they give you a blood test, they'll send you the results there too.
Right.
So it's like, it's online, so it's like having your own little medical record.
Yeah.
I'm gonna put it like that with you, and you could see all your information, and it has the medicines you take and all that stuff. It's really I like it's really good to have. It's a good thing to have.
It's a tool that you
Yeah,
use.
it's that's the word I was looking. The tool. It's a good tool.
Thanks, Sonia. Tom?
I have a friend in Michigan, they don't have my chart there, but the hospital has her doctor has like a nurse on call. You can get almost 24 hours a day.
That's what I was
And
gonna
they're an
say.
intermediary between you and the doctor if there's anything like this.
Yes.
And that might be an option for
I
somebody.
think that's great, and so the other thing to remember with these medications is that your doctor may say, so if Tom, for example, goes in particularly with the glucophage, for Tom's example, the doctor might say, you know what, I need to see you first, All right, and so just be prepared for that, that might be a con. Another con might be that, sometimes these once-a-day medications are a little bit more expensive, and they may not be covered by your insurance, just to make you aware, okay? Yeah.
And another way, when I don't do my chart, or like you mentioned the nurse, I call the Metro Health line, to the doctor's
That would be the
office.
nurse, yeah.
And I do call and they, I ask them to connect me with the nursing station.
Yeah.
And they get me the nursing station, I leave a message for my doctor, and he
Perfect.
calls me right away.
Okay, perfect. So these are all great ideas, TTIMers. The last solution that we talked about, which was I can just give up on the medication entirely, since I'm still depressed. Or, again, going back to Tom's great example, it's not working anyways. I don't feel any different if I don't take it. Is that right, Tom? Is that what you basically were saying?
Same with the depression medication I take,
Okay,
yeah.
okay. So you know what? I'm just gonna give up. Right? I'm kinda apathetic, it's not working. The pro to that would be, there's no hassle there. Probably even save money, right? Okay?
Yes.
The con would be, I might even get more depressed, right? And even more importantly, I ended up in the hospital the last time I did this. Okay, but following on Tom's example, my blood pressure might be going sky high and I don't know it. Or my A1C is out of control and I don't know it.
Or I'm
Right.
depressed anyway, it doesn't seem to matter.
Nothing
Unless I
matters.
wind up in the hospital, but I don't think that far ahead.
Okay, thanks, yeah.
And then it could be the medication. They might have to take them off that medication and put them on something
Yeah.
else.
Right,
It could be that.
absolutely.
I thought about that, you
Right.
know?
Okay, so act on the best solution. So we've gone through 3 steps now, and we're gonna do the last one, we're gonna act on the best solution. There's no perfect solution, would you guys agree with that? When we solve problems, there's rarely the perfect solution, but there's better solutions. Your best solution might be the one with the most positives and the fewest negatives. That would be true, right? All right, solution number 2, looks like it might have been the best trade-off with the pros and cons. It might be the solution that you tried first. How do you guys feel about that? Do you agree with that?
Yes.
Okay, that's okay with you guys? Okay, all right. So everybody has this worksheet in front of them right now, which is just going through the idea steps. Where you identify the problem, the possible solutions, evaluate them, and then act on the best solution, okay? I'm gonna defer to my peer mentor here, ask her to think about and describe a problem that she might have dealt with in the past, and then ask others to participate, okay? You okay, Loretta?
Yeah.
Okay. Perfect. Oh, you already, thanks, Sonia.
Yeah,
Thanks for-
I had one,
Sonia,
but
coming
something that
prepared.
happened to me personally,
Okay,
so.
perfect.
My little problem is, I hate going to the pharmacy to pick up my
Okay.
meds, or I forget to go and they call me there and it'll pass 2, 3, 4 days
Okay,
until I get to the pharmacy, sometimes even a week, to be
okay.
honest, so.
Perfect. So
that's
your
fine.
problem is, can you define that then more clearly?
Yeah, going to a pharmacy to pick up meds,
Yeah, picking up, for some reason, that's,
yes.
and Sonia's a very busy mom and grandmother and everything else, and so this is just one more thing for her.
Yes.
Okay, so what is your solutions? What are your possible solutions, Sonia?
Well, one of them is tell my daughters to pick them up,
Okay,
they could, if I babysit, they could pick them up.
okay,
The other one, talk to my doctor, or get them, try to find a solution with him, or get them delivered at home.
give them the deliver, okay?
Some places do deliver.
Yep. Anybody, T-Timers, would you guys think of any other solutions that we could add to her list? Remember, this is totally brainstorming. What can we add to Sonia's list?
Just think of the drug plan I have, they have a mail order
Mail order. So-
process
Yeah,
where
that's
you
what
just get them delivered. I don't know if you're talking about local pharmacy delivery, or this mail order thing from
There,
somewhere in
I've been,
Pennsylvania.
I've been looking to see if there's a couple of places that do deliver still.
It sounds like Tom thinks that's a great idea. You
Oh,
can
yeah.
use that, Tom. Okay.
And there's another one, maybe you could change pharmacies. Change pharmacy closer to you.
It's not that far.
Okay.
Oh,
So Sonia's being honest. She's like, it's really just getting there, right?
Just getting there.
Okay. And I think if we're all think about it, there are those little niggling problems that we have that it's just, it seems so simple, but yet it's just getting there, right?
It's not far, but I still have to drive to it. You know, so it's like, and if it's a rainy day, you don't want to go out. If it's snowing, you don't want to go out.
Yep.
During the summer, there's not much problems because you like being out.
Okay,
Could you walk and get your exercise?
That's what I was going to
Actually,
say,
I
it's
could
time for
probably walk up there, but
exercise.
it's still a couple of blocks out.
Oh, that's terrible.
Yeah, but I just it's that I don't know. I've had
it's
that.
kind, it sounds a little bit like a lack of motivation too, just
Yeah,
to get
that's
it done.
that. I think that's what it is.
Okay.
Because if I'm home, I don't want to go out. The
Because
minute
you're
I
already
go-
home, yeah.
I don't like going back out.
Okay, all right, so anybody else have any other solutions that we might be, cause, okay, then we're gonna close down the solution ideas, now we're gonna evaluate them with pros and cons. Okay, your first idea was you were gonna tell your daughters, ask your daughter,
Yes.
the pro to that would be what would be the pro to that?
Well, maybe they're working or in school and don't have the time either.
That would be the con, what would be the pro, if
Oh,
you ask
the-
your daughters?
The pros,
Yeah, the positive,
the positive, they would say, "Mom, I'll pick them up
right, so they'd
if
agree
they have
to
the
it,
time."
they'd agree to it.
Yeah.
The con would be maybe they don't have the time,
But they don't have the time.
right? The next one you cited was Tom's idea and your idea, which mail order, right?
Mail,
The-
yes.
the,
Or
uh,
delivery
pos-
or
yeah, delivery, so the positive to that would be what?
Yeah, that's all positive there.
Yeah, what
'Cause
would
it's
be the,
getting right to your door.
but what would be the con to that? What would be the
They don't
negative?
come on time.
They
something.
don't
So you
come
have
on
to
time.
rely on somebody else.
You have to rely on somebody else?
Yeah, because you have,
Yeah.
because you have to be
Although
most
might be-
responsible for picking up your prescription.
Right, she's
yourself.
saying that, well,
I
she's,
understand what she's saying,
yeah,
yeah.
okay, go ahead,
Or they don't deliver it to the right house.
okay, okay.
You never know.
Or how about this, how about you have to set it all, the whole system up, right?
Yes.
And sometimes that can be a hassle, right? Okay?
Yes.
Okay, all right, so there's the con to that, and did we have anything else, was that the last one? We just had the two, is that right? Am I right, did I remember anything?
Yeah, I'll talk to the doctor.
Talk to the doctor about what? What would you talk to your doctor about?
I don't know, changing some meds that'll be taking them less, maybe
Okay, okay,
less medicines.
okay. So
Maybe a longer prescription. I get
a
mine for
90,
I get mine for 90 days.
For 90 days, yes, that's
I
what I was
thought
gonna
about
say,
that one
yes.
too.
And I'm ashamed because my pharmacy's right across the street. There's
Okay.
no reason.
it's
Yeah,
sometimes
but
less
yeah,
expensive, right?
It's
To
less
get
The 90
expensive.
days
It
will
is,
last
it
you at least for 2 months, or
It is
maybe
the
more,
apathy
3
that
months.
Sonia
Yeah.
talked about, and I agree with it. Sometimes you just, even though for me it's across the street,
Yeah.
it's hard to do it.
Okay,
And
I like
sometimes
that.
a 90-day prescription is just as reasonable. They charge the same thing for 90 days.
Yes,
for
they
30
do
days.
for
right,
30
so it's
days.
so let's get back to that 90 days, so that's one of the solutions, the pro would be cost,
Cost.
less time I have to go to the
Yes.
doctor, right?
Yeah.
What would be the possible negative to that idea?
If you're not paying for it out of your pocket, your insurance may not be able to pay for it
Then-
all at one time.
Maybe, okay,
Maybe.
maybe the cost could be a problem.
Yeah.
What's another negative that you could possibly think of?
Maybe if you change prescriptions, now you have all these pills
Yes,
that you don't need
That's
to take
right.
anymore.
okay.
Yeah.
All right, so now it's up to you, Sonia, which solution are you gonna act on?
Let me see. Go to the pharmacy, pick them up. No,
Yeah,
no,
right.
Walk to the
Yeah.
pharmacy.
yeah, walk to the pharmacy. No, get them delivered.
Okay, all right,
Talk
so
to
what do
the
you guys,
doctor, get a prescription.
have it
Get-
delivered at home, okay, what do you guys think of that? I like that
I
idea a
agree, yeah.
lot.
Very good.
And I like
like that idea, and I also like the idea of having your daughters pick your prescription and not having, I don't have enough time.
Oh,
Be
no,
a
no, no,
choice.
the thing I don't tell them, because if I told them, they'll go pick them up. You
Okay.
know,
Well, you should tell them.
let's stir it out. If I tell them go pick them up, they'll pick them up.
Okay,
I
all
just
right,
haven't told them.
so this would put it all on you, I mean, in other words, you still have the control though,
Yes.
would you guys agree with that?
Yes.
Okay. So how, is there anybody else who would like to, have an idea that they'd like to work on with the group? Anybody else in the group? Remember, we talked about the importance of group participation, and anybody else have a problem that they can come up with? Tom, you shared a great problem
Yeah,
earlier
yeah,
with
just
the
I keep thinking
glucophage,
about that one still, so that's my problem.
Yeah.
That's my contribution.
the glucophage and not noticing any
Oh, and then
difference.
the mental health stuff too. Skip it for a day or two, it doesn't even matter. So.
Okay, all right,
Blood
Don't skip
pressure.
it for a long time.
okay.
No skipping it for a long time, because then they'll be.
Okay, so Tom's problem is, he doesn't can I put these in these words, Tom? I don't necessarily notice a difference whether if I take my medication regularly or if I don't take it regularly.
Precisely.
Okay, all right. So, but we know that, I know as a nurse, the importance of you taking particularly, well, all three of the different ones you described, your high blood pressure, your diabetic, and your mental health medications, the importance of taking them regularly. So what could be some of the solutions that we would work on with Tom? What can we do to help Tom say, you know what, for the next 30 days, I'm going to take them regularly? What do you guys think of? What are some possible solutions that Tom might come up with?
Well, one thing that was related to the previous was taking them at bedtime. I've often thought about getting an alarm clock. Supposed to take them twice a day. Just setting the clock for like 8 o'clock. If it rings at 8 o'clock in the morning, it means I take medicine. When it rings at 8 o'clock at night, it means I take medicine.
Medicine. That's a good idea.
Okay, it sounds like that's a great idea. Okay, so the pro to that is you're gonna be reminded by your phone, which you have with you all the time. Is that what you meant, or an alarm clock, a real
regular
alarm
No,
clock?
my regular alarm clock.
Like
Okay,
a
that's
real
right.
alarm clock?
A real alarm
A
clock.
real alarm
That's
clock.
a
The
good
kind you wind
It's
up.
still a great idea. Okay, what could be the possible negative to that? And you don't have to have one.
No, I just, the thing I was thinking about the alarm, I'm thinking it's always on, so I mean, you just turn it off and turn it back on again,
So you mean you could still bypass the alarm?
Well, I
still-
could go up to turn the alarm off and still forget it.
And still
I mean,
forget
it's
that
still
it-
the apathy problem.
Okay, so okay.
But since I'm up anyway to turn the alarm off, I kind of think that I might be inclined to take the medicine.
Okay, so that would be something you might act on. What does the group think about that? I really like that.
That's a good
Like that
idea.
one.
You like that? You like that too?
Yeah, I like that.
I like
I
that
want
one
to
too.
comment on that.
Okay, why don't you comment on that?
Okay, I have a brother that he has a watch, and he have to take his medications so often. So besides the alarm that you have in your house,
Mhm.
he have a watch that every time I'm with him, the alarm going off. He said, "Oh, I got to take my medication. I don't care if it's a vitamin or it's just a regular vitamin C or something. His alarm always going off on his watch wherever he go. So you can probably carry your watch, get your watch or have it set on alarm,
Well, I was thinking 8 in the morning, 8 at night,
Mm-hmm.
alarm at home. I'm always at home at 8 in the morning.
Yeah,
I'm always
always
at home
home
at
at
8
8
at
at
night,
night,
you
so
know.
yeah.
I'm out in the daytime, so.
But you can also see whether or not to agree with that with your doctor, because if he got you on a certain time scale for you to take your medicine,
Right.
that might be important too.
Right, right.
Well, it's always like twice a day.
Yeah.
It doesn't say
Also-
when, so I
Yeah.
assume it's morning and.
No,
Yeah.
in the evening, yeah.
So Tom, would you be willing to work on that solution
Oh,
for a little bit?
absolutely, yeah.
Okay. Well, thanks. That was thanks for sharing, everybody. I think that was a great problem solving. We had some very good examples there. Very good examples. And you can see how medication management can be very challenging, right? But again, remember, the idea is how can I manage so that my health can stay very positive? So I can do the things I want to do, right?
Yes.
All right, okay. So the next skill that we're gonna talk about, if everybody's okay, we're gonna move ahead to the next one, which is tools for effective communication with your healthcare providers. Who thinks that we need tools? Who thinks this is a challenge? Right?
Very fun.
Yeah, this can be very challenging, right? Okay, all right. So the relationship that we have with our healthcare providers is a very important one, particularly if we have a chronic disease or diseases, right? We need to have trust and a good relationship with our healthcare providers. It's very important that we communicate with our providers so that we can learn about diabetes. Now listen, every person is different. So the things that you might hear from the person sitting next to you at the hairdressers or on the internet, you have to take that with a grain of salt. There's a lot of information out there, but you have to bring that information and discuss it with your provider, all right? Every person is different and people have different reactions and responses to different medications. Many of you in this room know that to be true. Maybe you started off on one medication and it wasn't as effective and they moved you to a different medication. That often happens in chronic illness, like with high blood pressure, diabetes, and certainly with mental health concerns, okay?
Yes.
So everybody is different and responds differently to medication or types of treatment. One person might take a medication for blood sugar and it's gonna work very, very well, while another, the medication might be less effective. That's where the communication really happens. So it's important for you to discuss your treatment questions and expectations with your provider. Some people get very frustrated with their treatment and they vote with their feet. What do you think we mean by that? What do you think the authors of this program mean by they vote with their feet?
They just don't go to the doctor, or they go somewhere else.
Yes.
Just physically do something different.
That's right, right. You just vote, I'm just not going back, right? Has anybody in this room ever done that before?
Oh, yes.
Okay, thanks Loretta for sharing that.
I've doctor shopped, if that's the same thing.
Or doctor shop, okay. Loretta, what do you think when you say, like Tom said, he doctor shops? What do you mean by you voted with your feet?
Yeah, just don't stop going, and I have my particular reasons, and I've communicated with my primary care doctor that I'm not learning from him. Whatever he communicates to me, I can retain it as long as I'm sitting in front of him. But he makes these little graphs and charts and hearts and this and that on the paper. He knows what he's talking about, but when I get home or the next morning,
Okay,
I can't read that. I don't remember
okay,
what it's about.
okay.
And therefore, I don't know how much insulin I'm supposed to take in the morning because I'm trying to do it the way he wants me to do, using his little graphs and schematics and all that. And it just doesn't always happen for me.
Oh, wow, Loretta, thanks for sharing that example. That is very powerful because managing your diabetes with insulin is very, very important, right? You've got to make sure that your dose and you're following your doctor's prescriptions, right? Okay, so that sounds really important. I think Tom, do you want to speak to your idea of doctor
It
shopping?
was the same thing. I see one doctor, I don't quite understand what he or she's saying. They don't seem to communicate, and I don't feel any better. So through the system I'm in, I'll just contact and see, or go to another doctor.
Okay,
Exactly.
okay,
Keep trying to find one,
Yeah.
like they tell me what I want to hear.
That's
okay.
right.
Yeah, important to have
That's
good
what I would
communication
say.
with your doctor.
It is
Go
really
to
important.
another doctor.
Okay, so a couple of things that I think from both Loretta and Tom shared is that the importance of, I need to understand what you're trying to communicate to me, or I can't do it, and I can't activate on it, right? Okay, the other thing that Tom briefly mentioned on it, until they tell me what I want to hear. Very important to understand the difference between what I want to hear and what I need to hear.
Yes.
Okay, so oftentimes as patients, we want to hear one thing, but it's the provider that tells us what we need to hear or makes us want what we need is really a very special provider, okay? So that they make us really want to do this because that's what we need to do, okay? But I think what Tom described is very common, right? We're frustrated, we're angry. So let's talk a little bit about how can we communicate with our doctor a little bit better, all right? Because when we vote with our feet, in the long run, that causes lots of problems for us, all right? There are several barriers that keep us from building trust and keep us from being able to communicate in the best way possible with our providers. Let's review some common barriers and some tools that we can get our needs met, okay? Now, time. What do you guys think about time? When we,
It's not a lot of time. It's 15 minutes with the doctor usually.
okay, 15 minutes with the doctor. That's exactly right. Actually, it should be about 20, but sometimes it
20.
feels like
Yeah,
15, doesn't
yeah,
it?
it should be 20, but sometimes
Okay, so you know they're frustrated by time,
Yeah.
right? Okay, so time's a real problem. Our providers often have a very short time allotted for appointments. Do you think that frustrates them as much as it frustrates you?
yes, it does.
I'm sure it does.
I'm sure it does, I'm sure it does, because their schedules are packed, right? Okay, language, right? Loretta described a language which was the science language. She's like, I didn't study science in school, maybe you did, but I didn't study to this level, so I don't understand. We often use words that we're comfortable with, but maybe our providers are comfortable with it, but we're not comfortable with it, right, Loretta? So you're saying, I'm seeing all these numbers and these graphs, and you know what, that's Greek to me. Is that what you're saying basically?
Yes.
It's Greek, I didn't study Greek, right, okay. So language can be that, but language can also be foreign languages.
Foreign.
We don't understand foreign languages, right? Or maybe I'm Spanish speaking and my provider doesn't speak Spanish, and so now I'm stuck on the language line.
Yes, I had to go with my mom to her appointments because my mom didn't speak English. And then by the time they would get somebody, sometimes, even if it's Spanish, let's go like they use, depends what race you are.
Different dialect.
Yeah, they do. It's different.
Yeah.
Sometimes they say something you're still like, huh?
Right.
So I had to go with my mom to all her appointments
And that's
because of
great
that.
that you did. That's great that you did,
Oh, yeah.
Sonia, because that's, actually, we're gonna come to that later in this particular class, but the idea of bringing somebody with you.
Especially being a nurse.
Yeah,
It's a
yeah.
Oh, yeah.
double
Somebody
bonus.
can hear more than you can hear. Okay, so language meaning your language or their language, right? Okay, so a lot of the medical centers will often invite people from different countries to practice in their health system because they're a very popular health system, and so you might come across people with different languages, right?
Exactly, because like on a lot of mental health call line, you'll find a lot of language barriers there, and they don't understand you, and then they'll say sometimes, me don't speak much English. And then I'll try to, talk to them in English form.
Mhm.
Now a little French I can speak, but when they be talking to me and they be trying to get my information and everything, sometimes it's hard. They'll repeat themselves over and over again.
Oh yeah, that's
Sometimes
I
it
think
be
to all
hard.
of
Okay.
all of them.
Yeah, so that can be really hard. Emotions. So when we see our providers, oftentimes we're walking in the door with a whole bag full of emotions, right? We're frustrated, maybe we're, as Tom said, I'm still struggling with depression. Maybe you fought with your daughter before you walked in the door, right? So you're coming in with emotions, but your provider also might be frustrated, right? Who knows what they came from in that day,
Yes.
right? So it's a room full of different emotions that you have to deal with. But patients, and that's who we are, often feel angry or frightened by their diagnosis. Or maybe you expected, Sonia, maybe you expected a grade A1C and maybe it wasn't, right? So you're frustrated. I did everything you told me to do, right? Has that ever happened to anybody in the room? I did everything you told me to do and my A1C is still sky high, right? Okay. Maybe you're frustrated if your provider isn't able to give them enough time during their visit, or they might feel the whole healthcare system is failing them. Right? Okay, so let's go through the tools and see if we can agree to these, or maybe we want to add some of them. Okay, tool number one is you're going to prepare for your doctor visit by thinking about what concerns or questions you'd like to discuss with your doctors. Some people find it helpful to bring a support person with them to the visit. Sonia did that for her mom,
Yes.
right? Okay, so prepare for your doctor visit by thinking about what concerns you would like to bring, okay? Do any of you guys do that? Do any of you guys?
I do.
So what do you do, Sonia? Can you
I
describe
usually
it
try to
again?
have it written down
Okay,
or put it on the phone.
okay, so your questions. that
My
you have.
questions, or test results if I have a doubt about one out.
Mhm.
I would ask.
Okay,
My problem is that I was with my doctor for 20 years and he left me.
you love it. So you had a good relationship with your
Oh,
doctor?
we were, me and Dr. Freeze, we had a great relationship.
Okay,
And he retired.
so that was disappointing.
Very disappointed. I cried.
Okay.
Still hurts.
Well, that's great. Actually, that's the kind of relationship we really want, right? Wouldn't that be great for all of us? Okay. All right, so you're gonna prepare by asking questions, and we're gonna go over a couple things after we go through these tools for different concerns that people have to bring them to your mind. So when you go in, make eye contact and say hello, right? A lot of times when we go to see our providers, sometimes in our healthcare system, we always think of our providers as being they're an authority figure, all right? And I know a lot of providers are trying to bring you into the decision-making with them, and they don't like being authority figures, but sometimes we have that in our mind, right? So, the authors of the TTIM curriculum thought, well, yep, say hello, make eye contact, shake hands if this feels comfortable to you. How many of you shake hands with your providers?
I do.
You do?
Yes.
You do? Okay, all right.
Not anymore, they don't. A
Yeah.
doctor stopped doing that.
It depends the doctor.
Yeah,
Mm-hmm, mm-hmm.
in the season.
And the
Yeah,
season.
the
Flu
season
season,
too, yeah.
flu season.
Right, so Tom brings up